Good afternoon, Mr. Thompson. My name is Jana, and I'll be looking after you today. How are you feeling? Good afternoon, nurse. I'm not feeling too well. I've been having this sharp pain in my chest for the past few hours, and it's really worrying me. I'm sorry to hear that, Mr. Thompson. I understand how uncomfortable and concerning chest pain can be. I'll be assessing your symptoms to better understand what might be causing this. Can you describe the pain for me? Is it sharp, dull, or like pressure on your chest? It's mostly sharp, but it feels like a heavy weight on my chest too. It comes and goes, but it's been constant for the last 30 minutes. I also feel a little short of breath. Thank you for describing that. Based on what you're telling me, I understand why you're concerned. I'm going to ask a few more questions to assess your situation further. Have you had any similar symptoms in the past? Any history of heart disease in your family? No, I haven't had anything like this before, but my father had a heart attack when he was about my age. I'm really worried it could be the same thing. I can understand your concern, especially with your family history. I'm going to monitor your heart rate, blood pressure, and oxygen levels now. I'll also arrange for an ECG to check the electrical activity of your heart. Chest pain can sometimes be caused by a variety of factors, but it's important that we rule out any serious conditions such as a heart attack. I'm really scared, nurse. I don't know what's going on, and I'm afraid I'm having a heart attack. I understand your fear, Mr. Thompson, and I want to reassure you that we are doing everything we can to figure out what's causing this pain. Chest pain doesn't always mean a heart attack, and many other conditions can cause similar symptoms. Right now, we need to focus on getting the right tests done to understand what's happening. What kinds of things could cause this pain, other than a heart attack? Chest pain can be caused by a number of things, such as muscle strain, heartburn, or even stress. In some cases, it could be related to your lungs or the ribs. That's why we'll perform some tests, like an ECG and blood tests, to make sure we have a clear picture of what's going on. Will I be able to go home soon, or will I need to stay in the hospital? Once we've completed the tests, we'll have a better idea of whether you need to stay in the hospital for further observation or treatment. If it's not a heart attack and your symptoms improve, we may be able to discharge you with instructions for follow-up care. However, if we find any signs that require further treatment, we'll make sure you're well cared for here. Okay, I guess that makes sense. How long will the tests take? The ECG will take just a few minutes, and the blood tests will take some time to process, so we should have results within the next hour or so. Once we have all the information, we'll be able to discuss the next steps with you. And what will happen if it turns out that I've had a heart attack? If the tests show that you have had a heart attack, we will immediately provide the appropriate treatment to stabilize you and help your heart heal. This could include medication to dissolve any blockages, and in some cases, you might need a procedure called angioplasty to open up any blocked arteries. But I want to reassure you that you are in the right place, and we will make sure you get the best care possible. Thank you for explaining that, nurse. I'm just so anxious right now. I completely understand how you're feeling, Mr. Thompson. It's normal to feel anxious when experiencing chest pain, especially with the possibility of a heart attack. But please remember that we're here to support you, and we will do everything we can to ensure you're taken care of. I'll be right here with you throughout the process. I appreciate your support. I'm just hoping it's nothing serious. We all hope for the best outcome, Mr. Thompson. Rest assured, we'll keep you comfortable and monitor you closely. I'll go ahead and arrange for your tests now, and I'll be back shortly with the results. If you need anything in the meantime, don't hesitate to call me. Thank you, nurse. I'll try to stay calm. You're doing great, Mr. Thompson. I'll check in with you soon. Feel free to let me know if you need any further changes.